One of the things that we're talking about this morning, also something else that may interest you that you might like to add your thoughts to. Should medical cannabis be more widely available for illnesses? Have you used it for a condition and has it helped? Well, this week is Medical Cannabis Awareness Week. That raises awareness about the access and availability to safe and secure treatment for those who have chronic health issues. It comes on the back of a new report that reveals nearly 1.8 million people with diagnosed medical conditions in the UK are turning to illegally obtained cannabis to manage their illness. Well, let's first talk to Charlotte Franklin, who's from Forest Row and uses medical cannabis on prescription. Thank you very much indeed for joining us. Just tell us first of all, what made you turn to this for your condition?
Oh, well, I saw it in the newspaper, actually, and I hadn't really smoked cannabis or marijuana for ages, but I had actually gone to a conference in Amsterdam in May and had some, and I thought, God, this is actually great. And I've got ADHD, which I was diagnosed with quite late in life, about 2 years ago now, and I'm almost 50. And I'd been prescribed Ritalin and Adderall, and it was, it certainly helped me crack through the work, but I sort of felt like in the end I was going to have a heart attack from it because it was just so weird. And having it in Amsterdam, I was just like, God, this actually gets me to just sit down quietly and do stuff.
So it was kind of, I suppose, that you didn't know it would work so well, and then it did. But how easy is it? Because I think most people listening will think, well, I wouldn't even know where to begin to get this on prescription.
Yeah, well, nor did I. But then I saw a thing in the paper in the Metro, and it said it's available in the UK, and here's a list of things that we can treat. And it said ADHD. I was like, right. So I immediately filled out the form and got in touch. And within a couple of weeks, I had a prescription.
So simple as that. And you talk about those initial findings of the difference it made to your life. Has that continued? And what would life be without it?
Well, yeah, it has, and it's good to not have to go to Amsterdam and have it once a month or something. It's good to have it every day. And what it has actually done is it's slowed me down, whereas with Ritalin and Adderall, that speeds you up and it supposedly does some kind of double magic counteraction thing. But actually having marijuana has completely slowed me down at work, but I do things. So I just go completely into focus mode and just sort of plod along and get things done properly instead of in a mad panicked rush.
So are there any negatives to this? Are there any negative side effects that you've experienced?
Well, coming off Ritalin and starting on cannabis, the appetite does tend to change, but that's also quite good because it just means I have to go and do more exercise instead of just not eating. So I think all round it's had quite a few benefits. Yeah. So,
as far as you're concerned, then this should be widely and easily available on the NHS.
Yeah, I think so, definitely, because, a lot of people drink alcohol to cope with whatever, and, I think lots of people apparently, well, I can't really say this, but allegedly people are dying of heart conditions because of Ritalin, and I haven't yet taken it.
Well, it's interesting, obviously all drugs have got different side effects, and cannabis particularly is something that people are concerned about because it's not a legal drug in its own, unless prescribed. I understand, because we've spoken to people in the past that have tried to get hold of it, that you can't just get this from your GP. You have to have it prescribed by a hospital doctor.
Oh, what, the cannabis?
Yes. Do you manage to get it from your GP? Did you have to jump through a lot of hoops? You managed to get it, but was it harder than just getting any other drugs?
Well, no. I went when I called Mamedica, and I have obviously got an ADHD diagnosis. So, if I hadn't had that, I can imagine I would have had to have gone and got that first. But it was exactly the same as getting Ritalin once I found out I could get it.
Well, thank you very much indeed for joining us on the programme. Very good to hear from you. You can get in touch on 81333. Start your message with the word radio. So has it had an impact on you? Let's talk to Mamedica, which is the UK's leading private medical cannabis clinic, and they provide bespoke treatment to patients when traditional medication has failed. They've got patients from all over England, including Sussex and Surrey. So first of all, Jon, how easy is it to get hold of this?
Hi, Sarah. Thanks a lot for having us on your programme. In terms of accessing our service, it is relatively simple. A patient, in most circumstances, would self-refer to our service. What I mean by that is they would land on our website as a result from normally seeing us on social media or in a newspaper article, and they would need to fill out a 2-page eligibility form. The current inclusion-exclusion criteria for patients in the UK is that they must have tried 2 licensed medications, treatments or therapies prescribed by their GP or private doctor, and have had no previous episodes of schizophrenia or psychosis. And this can be evidenced by requesting their summary care record from their GP. Providing a patient is eligible and we have all the details in terms of identification and summary care record, this would qualify them for a virtual consultation with one of our specialists. So we treat patients who suffer from pain, psychiatry, neurology, palliative care and cancer-related conditions, and we evaluate the clinical need to prescribe a cannabis-based prescription medicine. So this can be done all in the comfort of the patient's home.
I've just had an email from someone, and this is from Pete, who says, a bit of a warning, be aware if you're taking other medication, speak to your doctor first. It may not mix with your existing medication. And it is important, isn't it, to go to the professionals and make sure that what you're taking works in your circumstances.
Absolutely. We're regulated by the Care Quality Commission, and the UK government has stipulated that medical cannabis can only be prescribed by a doctor listed on the specialist register of the General Medical Council. And that is why you cannot go and get it from your GP, and your GP will not talk to you about it. So essentially, our service provides that expert initial evaluation and that aftercare through follow-up appointments to ensure that our patient is receiving the most beneficial and effective medication for their treatment.
That's a private service, though, so I would imagine that there is a cost involved in that maybe puts that out of the reach of many people potentially listening at the moment.
Most definitely. I have to admit that clearly we have to work within the constraints of the current framework. And as it stands, NHS doctors, GPs, prescribe off the back of National Institute for Health and Care Excellence guidelines, NICE for short. And that provides very limited access to medical cannabis. Therefore, it is only available via a private service like ours. There is an initial consultation fee and follow-up fees. But as you can imagine, the cost for us to employ some of these specialist doctors is quite significant. And as a result, that's why we have to charge what we charge.
So it does sound as well, because we've spoken to people in the past who haven't been able to get this via the NHS. It does sound like there's quite a number of conditions that it can be helpful in, but also, as you say, that has to be prescribed with caution.
Absolutely. I mean, quite a lot of our prescriptions, the most common condition that a patient would come to us for would be for chronic pain. I would estimate that 60 to 70% of our patients come to us for chronic pain. A lot of the time for those types of conditions, we would be prescribing high THC products. But certainly if we're talking about psychiatric mental health conditions, it's medically accepted that high THC products could be detrimental to patients who have mental health conditions. And for those patients, we're actually prescribing high CBD products.
Well, very interesting talking to you. Thank you so much for joining us on the programme. I'd like to hear your experiences. Is this something that you have either got or tried to get? 81333, start your message with the word radio. Give us a call as well on our phone-in number. And I want to hear, is it all a load of nonsense? We talked to a group of local ghost hunters in the next half hour of the programme and find out about